one of my favorite subjects. I think that oftentimes nurses are really overlooked, right? We oftentimes will see device and manufacturing companies throwing an awful lot of resources at physicians and very few at nurses. But oftentimes we forget that the person at the bedside, 24/7, 365, is going to be the nurse. And while we can bring physicians along on a journey of improvement, if we don't really upscale nurses similarly, then who is caring for the patient during the times when there's not a physician at the bedside? And again, that is most of the time. Sometimes we forget that hospitals were actually created to provide nursing care. And yes, physicians practice in there too, but really they exist to provide nursing care 24/7. So it's exciting to see that, there are nurses interested in supporting nurses to grow and to really advance their skill set. But I really think this is an area that is underserved by the rest of the medical community. And it would be, really the right thing to do to look at how we can best resource our nurses, whether we're physicians, whether we're other nurses, whether we're manufacturing companies of drugs and devices, to get the best care for patients. We have to think of the whole team, and that clearly is nurses. So advanced practice nurses are really growing in leaps and bounds. And a lot of this is because when it comes to things like stroke, there's not been as much physician interest or uptake. And so that leaves a big gap into who is going to be providing care. So certainly there's lots of new roles that are evolving. Here in the States, we see nurses now that are very well tooled, very educated and skilled in their ability to go to the emergency department, assess the patient, clinically localize the lesion, take a look at the imaging and make TPA treatment decisions, for example. That's kind of a great example of how we are seeing the role evolve. Certainly, there's also nurses in the United States and perhaps elsewhere too that are also getting access in the cath lab, assisting with procedures in ways that usually more junior physicians would be assisting, and closing afterwards. So again, we're really seeing nurses step into really exciting new areas. And so providing resources to help our fellow nurses get there, I think, is absolutely essential.